Hello, Dr. Ahmad from Brackets, Wire and Smiles. I wanted to go over a quick video about expanders. Just a quick background on expanders. Usually we use them on younger patients, maybe 8, 9, 10, 11, 12, around that age. And the idea is to expand the jaw a bit more so we can make some room for the teeth. They come in two flavors. There's an expander that's fixed, which is basically like this, and then there's also a removable expander which you can take in and out. So we usually find that the fixed one that has bands around it tends to stay better in the mouth, and there's better compliance from the patient, and stays in the mouth until we remove it. And usually an expander is in the mouth for maybe 3 months or so, 4 months, depending on what's going on, sometimes a little bit sooner, sometimes a little bit later. So that's the general background about expanders. This is some of the stuff you'll need for an expander when you come to our office. We'll give you a key. This is the key that you'll use to expand the actual appliance. And the other thing we recommend is a phone with a flash in the back, so you can see, you can shine it into the patient's mouth and turn the expander. So the first visit, we will place a spacer in your mouth, and the spacer is just to make room for the bands that's going to go around the tooth. And the bands are these things that are around the expander, so they need to seat into the tooth, and that'll secure the expander. This is kind of what it's going to look like in your mouth. So this is the top jaw, and this is the expander. It's gonna sit on the roof of your mouth. There'll be a little bit of clearance underneath right here. And the idea behind that is to get any food that you eat kind of just wash away. We do recommend that when you have the expander in there, make sure you rinse your mouth after you eat something. But this is kind of basically what it looks like. There are a couple of these little arms here, and these are the arms that sit around the tooth to secure the expander. There it is. And then these are the bands. We call these bands. These bands go around the teeth. There's no pain involved when the expander is placed. There's a little bit of pressure when we start to turn the actual screw that's right there. And that screw is going to widen over time to expand the actual jaw. And what you're expanding is, you're literally expanding, there's a palatine suture right in the middle of your roof of your mouth. That suture expands slowly, and it starts to open up the jaw and makes the jaw wider. Also, when you start seeing a little gap in your front teeth, that's a good sign that the actual skeletal bone of your jaw is expanding, and that's a good sign. So don't be afraid of having that little gap in the front of your teeth. Anyways, that's kind of what the expander looks like. We have the expander turn usually once a day, and there's a quarter turn that expands the actual screw. I'm going to show you how this goes. So this is how it is. You're going to place the actual key inside of that hole. Once that key is in there, you're going to turn it towards the bottom of the mouth. There it is. And when you turn that, it's going to turn over the screw, and then there's a new hole that's going to come through right on here. And then next time you go in, you're going to use that hole to expand it. So you're going to place the actual key into that next hole. Sorry, there it is. Expand the key in the next hole, and then you're going to turn it like so. And then the next key is going to show up the next hole. You place the key inside there, and then you expand it. Use the flashlight. It helps out a lot, especially on a younger patient. And make sure when you slide, when you're done with the key turning it, you want to slide the key out. You don't want to pull the key out. All it'll do is it'll just go back in reverse. You don't want that. So that's kind of a little quick trip on expanders. Anyways, thank you. Take care.